Hi, my name is Julie. I'm here with another episode of Take One Patient. I'm here with Dr. Eric Wilke. I'm very excited to connect with him and kind of have him share some of his insight, being not only a physician, but also an entrepreneur and really getting into a lot of the tech that goes along with the emergency room and also just patient communication and patient care. So thank you, Dr. Wilke, for joining us today.
Sure thing, Julie.
So why don't you start a little bit and you give a little bit of background, because you'll do a lot better job than I will about kind of, you started as an emergency physician and kind of a little bit of your medical background before we dive into the other pieces that you're doing.
Sure. So, I went to medical school in Texas and started off thinking I want to do one thing, but then as you get exposed to other specialties and whatnot, I really gravitated towards emergency medicine. I liked sort of the fast pace, the little adrenaline junkie that had, and plus it was, other than nights, weekends, and holidays, shift work. When you're home, you're home, and so it was kind of a nice for family life. Wound up doing a residency out in Phoenix. Was there 4 years, and then was in emergency medicine, clinically practicing for 25 years. Still do some, but now it's a lot more admin and some other things that are, that we've got in the development. So, yeah, that's kind of the quick run.
The quick run of it. So definitely, I mean, practicing for quite a long time, you started to see, I'm sure, a lot of advancements, especially in the past 20 years. You said you were practicing in technology in different ways that patient care could be handled. What were some of the gaps that you kind of started to see in the emergency room that you wanted to address now moving into the physician standpoint or the entrepreneur standpoint?
Well, as we got involved in these freestanding emergency departments that were popping up everywhere, probably too many of them, and we're just looking at documentation solutions. And one of the things that we were interested in is, how do we record the conversation between the physician and the patient? Because what we know from studies and data, even highly educated patients with advanced degrees, a master's or a PhD, their retention of what is told to them is surprisingly low. And so I think the physicians have an idea that everything's being communicated and being communicated well. But the reality is that's not the case. And then the number one thing in the trash can outside of an emergency department is the paperwork, with all the printed, novella of information that gets given to them. And then, so again, as we started diving in and looking at what's published, we really wanted to condense down our printed instruction sheet to 1 page or less. Maybe sometimes it's a page and a half, depending on what it is, but really shrink that down. And then we wanted to do an audio recording. Nobody was doing it. We couldn't get anybody to do it. And so for better or worse, we wrote our own EMR, our own charting software. And as part of that was a media function. So you could add pictures, you could add audio. We didn't do video, which is kind of how you and I got in contact. But I think that recorded content given to the patient so they can listen to it again, digest it later, share it, I think has been a great win. And then, you get some of the initial pushback. It's like, well, what if I don't say everything I should say? Or, what if and then the problem is if you don't tell them what you're supposed to tell them, it doesn't matter whether you're recorded or not. And then on the flip side, everybody has the phone in their pocket, right? And so you should just run on the assumption you're being recorded anyways. I think there's a couple cases, one in anesthesia in particular, where they did not run on the assumption and the patient was under anesthesia and they said a bunch of stuff, and I got that person in a lot of trouble.
Yeah.
So again, I think I think this has the opportunity to really help patients. I think the concerns that people have are mostly unfounded. And like I said, don't be surprised if you're getting recorded, at any point anyway. So,
yeah. Well, and it's interesting too, as you say. I mean, originally, I so appreciate that. The reason that you started doing it was like, patients are not even reading this information. How can we provide them a second medium so that they're really understanding what's going on and they're really understanding the information? Because I had dealt with a dad that had was discharged from the hospital just from having a scheduled surgery. Like, I can't even imagine the emotion that also is wrapped around someone that is going into a medical situation unexpectedly, whether it be a heart attack or shortness of breath or any of those things where you weren't expecting to be there, planning to be there. Like, naturally, everything's going to be also a lot higher. And so providing that to the patients, I mean, is of tremendous value there. Now, when you guys started doing that, what was, you mentioned kind of the initial reaction of the providers, but what did you see as far as the impact it had on you outside of just patient care, and making sure that the patient had this information? But what kind of things did you see that impacted years ago when you started this, on your individual practice, and even, or are you as a provider?
Well, one thing that we discovered, or I discovered for myself, is I thought, I do a pretty good job of explaining this. But as we moved into the audio recording, we created basically a structured checklist of things to tell the patients. And then as you start doing just over and over and over, you realize, well, maybe I wasn't doing as good of a job as I thought. And so, having that, we call it the discharge checklist, and so you just kind of go through and hit all the items and make sure, one of the last things is like, do you have any questions? Do you feel like you understand everything we told you? Is there anything that we need to go over again? And I think that's very, very helpful. I think without developing it, and you can do that process obviously without having to be recorded,
Right.
but I think applying that checklist manifesto approach to making sure we communicate to the patients. And you mentioned, like, I have medical training, been doing this for a long time, but my mother-in-law was diagnosed with lung cancer. And so I was going to some of the appointments with her, and, I'm feverishly taking notes because this is, although I understand a lot what's going on, this is definitely outside my field of expertise. And I'm not familiar with the different types of immunotherapies or chemo that they're looking at doing. And so, it was very poignant to be like, you know what, I'm going to pull up my phone. I'm turning on the audio voice memo, and I'm going to record this because, there's just too much information going back and forth to me being able to write down everything that I need to. So, I think this is an important thing that should be embraced heavily.
Well, and the other thing is, a lot of our providers have even said, it also, you can almost see the patient relax. You can almost see like, okay, like, oh, they're recording this. Like, now I can actually listen to what you're saying without frantically feeling like I have to memorize everything that's coming out of your mouth.
Yep.
And so I think that some of it is, you even had mentioned before about, patients, like, you should always pretend like a patient's recording anyways. And they've done a bunch of studies that like 30 to 40% of patients secretly record, which is why is the need for it to be secret. But because they're just needing that, they're just like, I just don't understand. I don't know. They're not trying to get anybody in trouble. They're just, I need to know more information. I'm nervous. I'm scared. You know what I mean?
Right. And I think they're embarrassed to ask if it's okay to record, and so they're just going to do it on the down low but yeah.
For sure. Well, and when we started actually with one of our providers, and we found a similar thing, we utilize video as you guys are utilizing audio, soon to be video, hopefully, is like what some of our friends are like, I'm just really nervous to be sued. I'm really scared of that. And we did a bunch of different work to see, okay, what are the implications? Talk to a bunch of malpractice insurers and lawyers and all of that. And they're like, no, I mean, you're showing that you're educating. It's providing everything you can do for the patient. And I still will never forget the one doctor was like, well, what if I say something like illegal? And I was like, well, don't say anything illegal. Like, why would you be saying anything like, wait a minute, like, let's rewind this like interaction really quick, because like, you shouldn't be doing that anyways, regardless of it. Like, well, that's a whole nother value thing, man, because
right.
regardless there.
Well, we did something similar, so we took some actual recordings, and we're part of this captive insurance from our med mal, and we gave it to the lead defense attorney, and so she listened to it, And her comment to us was, please do this on every single patient.
Why was she saying, was it probably had a lot to do with the checklist that you guys were implementing, but what
No,
was kind of the bubble around that?
yeah, I think her view was like, this is concrete documentation that, you know, the patient was given the right instruction. They were told these things, and so she saw it as a great medical legal protection. Um, and that's we were approaching it to make sure we weren't getting in trouble, because we had to
Yeah,
we
right.
had to answer that question to the physicians, within the group. It's like, this is going to cause, I don't want to get in trouble.
Yeah.
So we weren't looking at it as a medical legal defense. We were just wanting to make sure we could reassure the doctors, no, there's no problem with this, as long as the patients are informed and consenting and everything else. Uh, and so it was a little bit of surprise when she came back and said, this is a great thing to do.
Right.
Please do this.
Well, and it's interesting also right off the bat that with what you were saying with the checklist and Atuli, is that the checklist manifesto book
Yep.
that you were referencing? Can't remember the last time it was. I can't remember, but it's interesting that you say that, because for a lot of providers that are considering recording, they're like, I believe in this. Especially since COVID, the impression of recording patients and that virtual aspect has shifted drastically. And so for a lot of them, it's just like, I don't know what to record. And so I think having like, okay, these are the 5 things that you should cover, or these, even for a nurse, these are the 6 things that you can cover. It takes the gray away and provides it just as you are. Like, as that lawyers had said, like, okay, if you're covering these 6 things on every single one of these videos, do it every time. And I think that probably is why that success has kind of happened, of not just, okay, here, record what you should, or record your discharge instruction. It should be kind of like, this is how that goes. I mean, have you found that your providers find that easier once you kind of provided that framework, or what kind of made you kind of go into that space, or you guys always did that?
No, I think if we're going to record, let's make sure we do it right and do it the best we can. So it's like, the patients need to know what their working diagnosis is. They need to know the tests that were done and the results of those tests, any treatments, what the expectation for follow-up is, and make sure we answer the questions. So it's just very basic things, but it's just to make sure you don't blow through it, or think you told them but you didn't, because you're just moving kind of quick. And it's not a fault of the physicians, but the emergency department is just rife with interruptions, right?
Mhm.
There's so many things, and so there's all this task switching, and every time you have one of those task switching, like, you lose the momentum of what you were doing, and so then you got to go back, and so if you get an interruption or something hits on your phone, or you hear something, and then you're trying to come back and pick up where you were with the patient, you may in your head have thought, well, I told them they need to see their doctor in a week, but maybe it didn't come out,
Right, right.
And so again, when you're sitting there looking at the checklist, going through, it's just a tool to help combat some of the chaos that's in the emergency department.
Right. And that's very interesting that you say that too, because I guess I wouldn't have thought about that. It's not even just like having, I mean, my dad, again, the only interaction I've had is a discharge. That's like, we're going to discharge you. It's like very planned, because it was a scheduled surgery. And even still, we're like, what? Like, let alone like, okay, he just left the room once he was explaining that. I mean, it's almost like wrapping this whole interaction in a nice, like, bow, if you will, being like, let's finalize what just happened here in the past hour, or whatever that might be. Now, for those providers that are, thinking about recording, or nervous that you're recording, and like, what, I could say it all day, right? But what as a provider, what advice or thoughts would you have as far as those contemplating starting to utilize technology like this?
Yeah, I would say, number one, assume that it's already happening, right? Assume that the patient's doing it. And so if you provide some kind of structure, or system in place, then that kind of brings it into the light. Don't be afraid of the medical legal risk, because I think that's been fairly definitively squashed. I think the information that we have back from patient satisfaction is tremendous. Like, patients really like it. I think it's very helpful. It's, again, just like you mentioned before, as I'm scribbling notes in the oncologist office with my mother-in-law, once I start recording, then I just write down, and I was more able to concentrate on the discussion rather than make, wait, did I get that right? What did they say?
Yeah.
And so it's a great tool. Like, why would you not want to use it?
Yeah.
is one of the questions that I would have.
Right. And I do think that's where we've come so far with COVID and the ability for people just to feel comfortable, but also with phones. I mean, everyone's I mean, just as you said, just assume it like all the time and then take ownership of it and take control of it. And as you guys have done really well, in your ER setting and then build out that checklist of like, okay, great. If we're going to do it, let's do it right. And these are the things that we can cover, just to make sure it's, covering us and them and all of the pieces. Awesome.
Yeah, because the screen that we have in our EMR, it's like when you hit the little record button, it's the page lists all the things that you're covering. So you're sitting there looking at it as you're talking to them. So
that's great. Well, and it's interesting too, seeing different capacities of how people have used it. Like we have medical memory is video recording option that the patient can have access to and then share it. But as far as, like a NICU nurse, she'll like, I've just read the discharge instructions, like almost over. I'm like, just recording the baby, like just as I'm doing it, versus like with, we're going to show scans or we're going to do, different genres or oncology. Let's go over the medications because all of the pieces are just different. And it's been amazing to see how different facilities have utilized it, built their own checklists, built even like, here's how to get in and out of a bed after surgery, like adding all of those elements that you don't think about at the time. And then you're like, wait, what? And the different specialties. So I appreciate that you do that and use that, especially knowing like the value I've seen it provide for myself and my family, and let alone, patients in that respect. So, thanks for taking the lead on something that I think is just going to become pretty commonplace, pretty fast as far as a tool for patient care.
Yeah, well, and we're talking a lot about, the discharge process, but there's, I think, another crucial element and that's patient consent, right? Again, because if, handing them a piece of paper that the nurse takes in and then the patient signs, that's not going to meet the bar of patient consent. Like it needs to be the one that's going to be performing the procedure, then, make sure all the stuff. And so, and again, in the emergency room, sometimes consent's a little tricky. Like if it's emergent, you just do it. Like you don't worry about that. But in these other cases where you've got a little bit more time, we've used it to document our consent and make, so we've explained the risk, we've explained the benefits, we've explained, the options for, other options. If we don't do this procedure, they get to ask questions and then you hear them say, I consent. Like, so I think it gives a much stronger and a much better format for patient consent on procedures.
Right. Which protects everyone, but then also is a checkbox for that provider of saying like, we have this conversation too. Because definitely that's one of the biggest things that we've seen, especially with medical memory is, a lot of our providers upload, videos that they created before that go over just that risk, benefits, alternatives, everything. And that it becomes more of a blanket of education and understanding for that patient versus like, okay, sign this. In that respect. And I know you guys, as far as with the emergency room, have kind of created a lot of those type of videos or content that also is saying, okay, these are all the things that you need to be aware of, patient, for the things that maybe you say most often too. But that's interesting as far as an emergency room, how much more that consent is probably relevant or needed because of a little bit of the rush. I guess, I mean, obviously if they're coding in those things, you just go, but still on some of that, like, of appendicitis or those where they're still aware, it's okay, well, we're going now, like we're doing, too. Awesome. Well, great. Well, thank you so much for joining us and talking about, this kind of new technology and how you guys are utilizing it. I know medical memory is very similar and close and how we're looking at video recording patients and providing that record. So appreciate what you do and thanks for hopping on with us today.
Thanks, Julie. And like I said, we're looking forward to kind of getting ours integrated so that we can add in that video component. So
awesome. Thank you so much.
all right, thanks.